We're here at Faith Regional, and if Spanish is your first language instead of English, you can still receive physical therapy. There's a physical therapist that can work directly with you. Let's meet him. I'm joined now by Tony Garcia, a physical therapist at Faith Regional Health Services. Tony, you're bilingual, speaking English and Spanish, so you handle a lot of patients where English isn't their first language.
The biggest thing is I start with the introduction, getting to know the patient. I don't always just assume that they're not English speaking. Once I've made that connection with them, it typically puts them at ease as they're able to communicate with me in a stress-free environment.
If you weren't here to be a one-on-one care provider speaking Spanish, what would the other options be?
The typical process is we would use a translating service either in person or over an iPad. The biggest thing with that is it does take longer as we have to communicate with the translator and then have them repeat the message to the patient versus myself. I'm able to just cut out the middleman and just speak to them directly.
Does that help establish a more direct connection between the patients and the provider when you're speaking their native tongue?
Yes. The biggest thing is it does put them at ease. One of the biggest things I've noticed since I've been here is we are able to service those patients more. To my knowledge, we have increased the amount of patients that we've had from the Spanish community compared to what it was before. But it does help to have that direct access. So most of the primary care providers as well as the surgeons here in town know that I'm Spanish speaking, so I typically get referred those patients.
Families often do an excellent job communicating and using children even as a translator, but sometimes, especially when dealing with healthcare, it's best that a professional's doing that.
I agree. Anything that would be beyond the capability of the child would make it difficult for the patient to understand.
How important is that from a healthcare provider perspective to increase the trust of a minority community in the healthcare system?
Well, it helps to provide trust. The look on their face completely changes when I start communicating in Spanish versus speaking in English. They all seem to respond to that very well.
Well, Tony, thanks so much for sharing your expertise.
Thank you.